Welcome back to High Now Daily. Right now I'm sitting down with Randall Juleff. He is the medical director and owner of Vein Clinics of Hawaii. Welcome to the show.
Thank you very much. Good to be here.
All right, well, let's talk a story. We are talking all about venous insufficiency. First of all,
yes.
What is that?
Well, venous insufficiency is sort of the large name of the group of problems that we deal with day in and day out. And it has to do with poor function of the veins in the legs. And it's a very, very common problem. Nearly 50% of adults in this country have some amount of venous insufficiency.
Wow.
So 50%. So of the two people sitting here,
yeah.
One of us.
Is it me or is it you?
No, I don't know.
Okay.
Probably not you. Let me just say that.
You never know, right? Because it can happen to a lot of people. You said 50%, right?
Yeah.
So who typically would have venous
well, venous insufficiency usually starts out as a genetic problem. Okay. So it's something that we inherit from parents and grandparents.
Okay.
And then, you know, other things, it happens a little more frequently in women because of pregnancies. Pregnancies can be hard on veins.
So it's probably me, is what you're saying.
Very well could be.
Yeah.
But also people who work on their feet all day long. You know, there's a lot of folks in, you know, this state certainly that work on their feet all day long.
Right.
And people who maybe carry a little bit extra weight, you know, those people are a little higher risk. But the problem is that when some veins in the legs tend to fail, and veins are the blood vessels that carry blood back up to the heart. You know, just kind of going back to biology 101, arteries carry the blood from the heart to the body, veins carry it back up. Now, blood through arteries flows because the heart's pumping. Not so for veins. Now, veins rely on little one-way valves inside the vein that keeps the blood moving upward on its way back to the heart. Those valves fail, and when those valves fail, the blood starts to settle downward into the lower leg, creates what we call pooling, and that pooling then can lead to symptoms.
Wow, and then what would happen if you got the pooling, you haven't taken care of it? Like, what are some issues that people would have?
Well, you know, one of the obvious things is varicose veins.
Right.
And, you know, one of the hurdles that we have to get over often is the fact that varicose veins is easy. If somebody has varicose veins, then they know they have a vein problem. But people can not have any varicose veins whatsoever. Some of the other symptoms are achiness, heaviness, fatigue, muscle cramping, restless leg, if you've ever heard of that, swelling. And then as it advances, it becomes you know, deleterious to the skin of the lower leg. It can lead to skin discoloration, skin breakdown, and you know, people have lost limbs because of that. So it's a much more serious problem than just, gee, I have varicose veins.
Right. Okay.
Or I have spider veins.
So then what is the treatment for that?
Well, the treatment luckily is much easier than what it used to be. I don't know if you've ever heard of something called surgical vein stripping. You know, something that was kind of done years ago, shouldn't really be done anymore, but those were surgical procedures, happened in the operating room, required a general anesthetic. People were in the hospital 2 or 3 days, that kind of thing. Those procedures have been replaced by minimally invasive, same day, you know, surgical kind of procedures we do in the office. Everything we do in the office these days.
Nice.
And people come in, they're there for an hour, and then they leave, and they go on with their day, literally.
In and out, right?
In and out.
In and out, okay.
Just like the burger.
Yeah, there you go. There you go. I love in and out. However, I wanted to talk one more thing before we go. You have to tell me what makes your practice so unique from anything else out there?
Well, we do, vein care is all we do.
Okay.
Most other practices that are, you know, out and around doing this kind of thing, they do it sort of as a secondary, you know, activity. They have their main practice and then they do, you know, some vein work. But we, you know, 15 years ago, I decided to, you know, specialize exclusively in vein care. I used to do heart surgery, arterial surgery, all that sort of stuff. So we really are exclusively concentrating on how best to treat the patient with venous insufficiency.
Nice. Okay, well, thank you so much for your time. Go ahead and check them out. VeinClinicOfHawaii.com. Go make your appointment there. Go check them out.
Thank you.
All right, thank you so much. We're going to take a break. We'll be right back. Great job, Doc.